Assalamu alaikum everyone and good afternoon. On the behalf of Department of Pharmacy Services, Shifa International Hospital, we welcome you all to just another exciting CE session. My name is Asmara Fakat. I am resident pharmacist at Shifa International Hospital. As a resident pharmacist, I'm deeply committed to ongoing professional development and I'm glad to be part of an organization that promote continuous learning. Throughout this session, we will delve into patient counseling skills for pharmacists. Patient counseling skills are essential for pharmacists to ensure medication safety, promote adherence, optimize therapy outcome, and enhance the overall quality of patient care. I'm immensely pleased that we have Ms. Salwa Ahsan with us today. She'll be further elaborating on this topic in detail. Ms. Salwa Ahsan is the Chief of Pharmacy and E-Shifa Home Care at Shifa International Hospital. She is a professional pharmacist with more than 20 years of experience and expertise in hospital and clinical pharmacy services. She is the first Pakistani pharmacist to become certified pharmacy executive leader from ASHP USA. In addition, she also holds the credentials of certified medication safety and pharmacy informatics experts from ASHP USA. It doesn't end here. Her specialties also include mentorship, quality standards of JCIA. She has served as expert member in policy board and other significant committees of drug, such as clinical studies and critical drug shortage committees, etc. She is currently serving on the board of studies of College Shifa of Pharmaceutical Sciences, Islamabad, and on editorial advisory boards of various pharmaceutical journals. She is also serving as the Senior Vice President of Pakistan Society of Health System Pharmacists. Without further ado, let's embark on the journey of learning and professional growth together. I invite Ms. Salwa to kickstart our session with her valuable insights. Over to you, Ms. Salwa.
Bismillahirrahmanirrahim. Assalamu alaikum. Thank you very much for your kind introduction. I'm really grateful that today we have a large number of participants with us for having this presentation. I know it's Saturday and most of our pharmacists and students will be observing day off today, but still they are here and they are interested in this topic. So this is really heartening to see. So I'll just share the screen for my presentation and this topic is really important because we all know that dispensing is our core function, and whenever we are dispensing medications, definitely it has to be accompanied with proper education and counseling for the patients and the caregivers. Because if there is any issue with the handling, storage, and use of medications or the monitoring of medications after use, obviously it can result to serious harm to the patients. So counseling plays a very important and crucial role. So I'll start my presentation formally with this dua. Bismillah ar-Rahman ar-Rahim, Rabbi zidni ilma. And we hope and we pray that whatever knowledge we gain today from this session, inshallah, we'll be implementing that into our actual practices and we'll try to benefit the patients with proper counseling techniques and education provided on the safe use of medications. The first basics actually starts from what exactly is counseling. So this is by definition is just providing medication information either verbally or in writing to the patients or their representatives, maybe their caregivers or their family members, on the direction of use, the side effects, the cautions, the contraindications, how to store the medications, what foods can be avoided, how to manage their diets if there are any specific dietary recommendations associated with that disease or that medication, or if you require any lifestyle modifications. And we all know as a pharmacist that there are several diseases where lifestyle modification would actually help. For example, smoking cessation, obesity management, or maybe sleep patterns associated with certain types of diseases. So these are the overall counseling, areas or sections which needs to be, delegated towards the patient or their caregivers whenever the medications are dispensed for further use. So why we do actually counseling? So counseling, this session is all about counseling. So definitely first we have to establish that why counseling is so much important. and what will happen if we are not doing proper counseling or we skip this important aspect while dispensing medications. So there are certain aims and objectives of the counseling. So if we have a grip on those objectives, then obviously we will try to correlate that objective with the type of medication that we are dispensing, and then by conscious efforts we will not try to omit the counseling in those patients. So first of all, it is really important to tell the patient that what is the importance and need of their medicines. So unless they understand the importance and need of the medicine, they are not going to comply with it, or they are not going to show adherence. For example, if the patient has angioplasty, for example, and a stent is placed inside the vessel, obviously that stent is really vital and important in order to ensure the patency of the vessel and to avoid any further complications and heart attacks in days to come. So for that matter, doctors usually prescribe antithrombotic drugs or blood thinners. So in order to ensure that the vessel patency remains and it does not get clogged again, and the stent placed inside have its valuable life. So if you tell this patient that why your antithrombotics, like maybe it could be clopidogrel, it could be aspirin or other drugs, this is the indication for this particular medication. And if you stop taking this medication, it will again, cause the blockage of your arteries and can lead to severe complications or heart attack, etc. So in this way, the patient would be able to understand that this is a vital medication. It's not any, just a nice to have supplement or a multivitamin that can be stopped and that may not have any implications on the health, and they need to continue this medication. The second thing that you want to tell patient is to how to prevent adverse drug events or errors and associated cost with that medication. And generally speaking, how to manage side effects, because all medications come with some kind of side effects. And many of times it happens that these side effects should be told to the patient, so the patient does not gets frustrated with it and stops taking that medication just because of that adverse effect or side effect. And the second part is that how to mitigate those. For example, if a drug is causing GI upset, you can always tell patients that you can take with meals to avoid GI upset. So patient would know that what to anticipate, and number two, how to mitigate that problem. So this is really important, because otherwise, if the patient is having GI disturbances, patient might stop taking that medications, which is very vital. And classic example would be, for example, methotrexate oral medication that is given for rheumatoid arthritis, and the biggest side effect of that medication is the vomiting, nausea, and these kind of side effects. So patients usually don't want to take methotrexate on designated schedules weekly. So if you tell them that if you have these vomitings getting severe or nausea getting severe, you can take antiemetics 2 hours before the anticipated dose, and you can take a second dose 12 hours after the dose. And with this 2 doses antiemetic regimen, you can safely use your methotrexate on a weekly basis, and you have less nausea and vomiting, and obviously the patient's compliance would improve with time. So this is how you are going to counsel the patient so that patients keeps on taking medications. Another important objective of the counseling is that how to safely and effectively store the medications. Because as pharmacists, we all know that if medications are not stored properly, they would have their effects on their quality and their efficacy. Especially the medications which require cold chain maintenance, refrigeration, medications that are to be protected from light, humidity, or high temperatures. So definitely we have to store them properly. And number 6 point is to prevent future complications, because many medications have their, future complications as a result of a prolonged use. A classic example could be if you are using PPIs, the proton pump inhibitors, for a long time. It can cause magnesium deficiencies. It can lead to more bone fractures. So obviously you have to stop taking these PPIs at a suitable interval, instead of the patient is on those PPIs for a long time. without any interventions and without re-evaluation that actually patients actually need these PPIs at this time or not. So for the future complications, you have to, intervene and you have to counsel the patients. And last but not the least, a pharmacist, we are professionals, we are the drug experts, and if during time of dispensing, pharmacist is not in front of the patient and they are not engaged into the discussion of all these aspects that I've just discussed with you, that how to, monitor their adherence, how to mitigate the ADRs, and things like that. If that expert is not visible to the patient, if that expert is not available to the patient for the advice, what's the point of calling ourselves professionals and drug experts? So this is our duty and this is our core job function, that we educate the patients on the safe use of medication. So during the whole presentation, I would request you to keep these 7 objectives in your mind, because I'll be giving you some examples further on this, and we'll be trying to correlate it with how to, actually impart the counseling with improved skills and all. So keep these 7 objectives in mind. So just to give you another, side of the story, if you talk about the medication access in Pakistan, what is the market share of different types of medication dispensing portals? For example, if you talk about retail pharmacies and chain of pharmacies, it encompasses almost 63% of clientage that patients are getting their medications from this forum. And if you talk about hospital pharmacy, private hospital pharmacies, or hospital-owned pharmacies or online pharmacies, it accounts for additional 10%. So it means that just the pharmacy outlets across the country, and they can engage almost 73 to 75% of the patients that are coming to them for their medications dispensing. So just imagine if we are able to do justice with this 73 or 75% patients coming to us, and we are counseling them in the safe and appropriate use of medication, their storage, definitely it would have a big impact on how the medications are used, and the outcome, the target of those medications for the disease management will be met. So this is really important, that whatever pharmacies we are working in, either retail or hospital pharmacy, whenever we have a chance to engage with the patients at the time of dispensing, we must do the counseling. Now, let me give you a little perspective from the studies. These studies are done within Pakistan, and I've just picked 1 or 2 of them just to show you that how counseling makes an impact. So this study was conducted in Punjab, and almost 560 plus pharmacies were engaged, and it was conducted in year 2016-17. And what they did, they tried to evaluate the counseling standards and ability of pharmacy staff to detect antibiotic drug interactions. So what they actually found out, that they saw that only 34% of the patients receive medication counseling directly. Directly means that a pharmacist on their own prompted to do the counseling, and patient was informed about various aspects. Whereas 45% of the patients received it on request, that patient asked the pharmacist that how to use it, please tell me, please let me know that this and that. So on their request, actually 45% of the patients were counseled by the pharmacist. And about 31% were referred to physicians without any counseling. So it means that if you talk about the overall counseling, it was just 34% of the patients that were given counseling directly by the pharmacist. Another important thing is that the most frequently provided information was the therapy dose, that how to take it, how much to take it, and what time to be taken, the duration, and the drug storage was ignored. Now, in the previous 7 objectives, I just like I told you, keep that in mind. Storage was one of the very important aspect, that how you are going to safely store it. But in this study, this important aspect of counseling was omitted. Another important thing is that about the side effects and the drug interactions, insufficient information was provided. So this is something that shows you a bit glimpse, and we all know while we are working in different setups like retail and hospital, we all know that definitely this is an area of concern, that the counseling by the pharmacist is an area that we need to really work upon. So another aspect is that only 2% of the patient receive information about the administration route. So let's see another study. This study was conducted in Mardan, and it was controlled with a control group, and they were actually trying to see that what was the impact of pharmacist counseling on the use of inhalers and quality of life of these asthmatic patients. So what they tried to observe is that in the two cohorts, in the pre and post education, the quality of life scores among the patients in which the pharmacist led the education really improved. And the correct use of inhalers and MDIs and DPIs was also significantly improved, and adherence status between the pre-education and post-education by the pharmacist group was also significantly enhanced. So this shows a very positive impact of pharmacists, and you can very well imagine that chronic diseases like asthma, like diabetes, like hypertension, and many others, they require lifelong use of medications. And if the patients are not adherent to their therapy and they are not getting the best, outcome out of their therapy, obviously there would be further burden of the disease, there would be further complications, hospitalizations. So you need to be very sure that patients are monitored for their effects and they are counseled on use of medications. So in a summary, the counseling saves life, definitely resources and time. But for this, you have to keep these 7 objectives in mind. Now, let me try to give you some very pertinent examples in order to demonstrate that how these objectives are met when an effective counseling is done. So just for the audience, once you see capsule, what comes into your mind? What should be the route of administration? You can write that in the chat box. So what comes in your mind? Obviously oral. So that's a very, I think, simple question, naive question. When you see a capsule, the thing comes to in your mind is that it is for oral administration. So that's the same for even for non-healthcare professionals. Although okay, we are healthcare professionals, but we are giving the same answer. But imagine that this information is given to a patient in the form of this packet where it is clearly mentioned as capsule. And when the patient opens this pack, the strips come out that also contains capsule. So what happens, obviously, that patients, since we are all tuned in that capsules are for oral administrations, the patient is going to take them orally. So, but by the way, you can also see on top of this capsule that is written that dry powder for inhaler, DPI. So what is missing here is that this capsule is to be used with a device, nebulizer, with which the dry powder can be inhaled. And we have seen many patients in even our pharmacy that have come for the refill of this medication. And when the pharmacist asks them, okay, sir, do you want this nebulizer or should I give it to you? The patient was shocked and surprised that why you are asking that and what is this nebulizer for? Because I have been swallowing this capsule since the last many days or weeks. And obviously, you can well imagine what would be their asthma condition or COPD condition once they are swallowing these capsules instead of inhaling them. So if you are not telling the patients about correct use of this medication, the correct use of the devices that are associated with many medications, nebulizers, insulins, rota capsules, and many other forms which requires devices for the administration, obviously you can well imagine that patients will not be getting the best response out of it. So once you counsel them, once you give them complete information, obviously there is a better control on the asthma and COPD, etc., for whatever indication they're using it, and patient's condition is better. So this, ticks the first objective on our list, that is the telling the patient about correct use of the drug, and that is leading to the adherence. And because patient is also witnessing improvement in their condition, so they were going to adhere with the treatment. Just imagine that patient swallowing these capsules and not getting any benefit. So obviously the patient is not going to continue with this medication saying that it's a bogus medication or इससे कुछ नहीं हुआ, मेरी हालत में कोई change नहीं आया. Let's see another example. This is Amina Bibi. and she is diagnosed with diabetes, and she's recently put on insulin. And we also know that insulins have a definite set of teaching for the patients, how to use it, how to store it, how to discard it, and things like that. So patient was given all this information, like how to use the needles, syringes, how to administer it, what are the steps of administering it, how to discard the needles and everything and that. But even then, the patient reported back after a few weeks with lipodystrophy. And can anybody tell me that why this happened actually? What is the cause of this? What is the cause of lipodystrophy when the insulins are used? Can anybody tell me in the chat box? Yes, so that's the correct answer. Same site administration again and again, and not rotating the site of injection causes the lipodystrophy. So this information, when not given to the patient, obviously you can well imagine that patient will be scared with these kind of side effects, and may leave the medications, fearing that something has gone wrong and something bad has happened to them. So this kind of counseling is also important, and in order to avoid any kind of the side effects of the medication. So this counseling really helps. So let's see another example. This is a young patient, Ali Murad, and he has been diagnosed with mitral valve disease, and patient is put on warfarin. And as you know that warfarin is a blood thinner, and this requires specific monitoring for the INR. And definitely, what are the important aspects that is to be told to the patients is what is your target INR? So if there is a mechanical valve, if it is a biostatic valve, what are the different target INRs that this patient is need to be following, 3 or 3.5 as per their conditions, how frequently they will be checking their INR. Like for the stable patient, it could be monthly, but patients who are recently put on warfarin, it could be even daily or weekly, depending upon the response of the patient. So at what stage patient is on warfarin therapy will determine that how frequently they will be checking the INR. And then you will be counseling patients about activities to avoid that can cause to injury and that can lead to bleeding, and important interactions. The food interactions, we all know as pharmacists that warfarin has a lot of food interactions with the green leafy vegetables and many others, and drug interactions, specifically with antibiotics. So these kind of information are to be provided to the patient. But unfortunately, in this case, patient was not given this information. And after a few weeks, the patient reported back in ER with severe bleeding and was admitted in ICU for several days, and length of stay was prolonged. Patient was admission was the cause of this, adverse drug reaction. And obviously, you can well imagine the cost, the burden, financial burden of this admission, hospital admission, and intensive care treatment as a result of the adverse drug reaction from the medication. So preventing complications with the medication is another target that must be achieved with the proper counseling so that patients remain healthy. So suppose if this patient, God forbid, died because of this bleeding in ICU, so the cause of death would not be mitral valve disease. The cause of death would be drug-induced hemorrhage. So that is something which is a preventable adverse drug event, and that was preventable with proper monitoring and with proper education that how you are going to monitor yourself. So we have to reduce these preventable adverse events and fatalities with our proper counseling and follow-ups. Now let's see another example. This is patient Saida. She is recently diagnosed with CKD, chronic kidney disease, and she's on dialysis. And doctor has prescribed her erythropoietin. And we all know that these patients suffer from anemia, and they need to have this injection erythropoietin in order to ensure that HB levels remain in target range. So depending on the patient's dose, it could be weekly, it could be twice weekly. So this patient was on Epokine as per her dialysis session. But an important information while dispensing Epokine to this patient was missed, that since it's a biological drug, and we all know that all the biologics like insulins, like erythropoietins, like filgrastim, like vaccines, and many others biologics are not to be frozen, because once they are frozen, they lose their potency, and this is irreversible. So she accidentally froze those medications, because we all know that electricity is a problem in Pakistan, and due to power outages, her fridge was not working. So she tried to, use some other means and accidentally froze this medication. So what is the impact of this medication? Just one injection worth 5,700 rupees. So if she wasted her two injections, that worth costed her 11,400 rupees. So that's a lot of money for a poor patient who is barely affording the cost of dialysis and barely affording the cost of medications. So this is something that is again a preventable loss, and that should have been prevented if the proper education about the storage of the medication was provided. Okay, so last point on the objective, that was the pharmacist a professional drug expert and there to help the patient. And I told you that this is our fundamental job to remain available at the patient service. So I'm just sharing this interesting US Gallup survey that they do every year to gauge the honesty and ethics of different professionals working in the country. So can anybody imagine that pharmacist किस position पे आया होगा? Any guesses? First, okay. Second, third, okay. अच्छा, यहाँ पे कुछ लोग कह रहे हैं 50th पोजीशन पे भी आया होगा. आई थिंक इतने बुरे हालात नहीं है. आप लगता है ज्यादा नाउम्मीद हो गए. Okay, so here's the result, and ये पिछले साल का US का Gallup survey का result है, and pharmacist stands on 6th position. So that's a silver lining in this, that के top 10 में pharmacists are there. Nurses are leading this Gallup survey poll for last many years, followed by a tie almost between the medical doctors and pharmacists. But important point is that in USA, you can see from 2019 till 2023, there is a 9% decline in the response rate. So there could be different factors, but what I'm trying to allude you towards with this picture is that pharmacists still remain a trusted top 10 professionals and the top four healthcare professionals, if you talk about even in developed countries like USA. And this is only because they are playing their role and they are being visible to the patients, they are interacting with the patients, and they are offering their services and expertise with all the support of different counseling and different measures. But in Pakistan, as I showed you the study, if we are not being visible to the patients and patients don't know that how they can take benefit of our knowledge about the medications, obviously, अगर यहाँ Gallup survey होगा, तो you can well imagine where would be the position of the pharmacist on that survey. So we have to strive hard that we have to change the situation in Pakistan and be available and be visible to our patients. So now I have established that the counseling is really important, and if you don't do the counseling, what devastation can you bring in the patient's life? So now just let us talk about a little bit that what are the different guidelines, what are the different skills that you are going to use for the actual counseling. So United States Pharmacopoeia gives a medication counseling behavior guideline, and it is a very simple tool. There are so many counseling tools are available, but I've just chosen this one as an example because I relatively found it very simple to understand and to follow. So stage first of the counseling, USP tells that it is the medication information transfer, where you give a basic brief information on the safe and proper use of medication. So ideally what happens is that on busy retail outlets or busy hospital pharmacies where you have lack of time to give a detailed counseling session to the patients, what we do is that we identify some key aspects, like we have to talk about the indication, we have to talk about the major side effects, how to mitigate those side effects, how to store these medications, and what medications or foods to be avoided. So these are the fundamental fives that you must be telling patients about these important things. And sixth could be if there are any associated labs that should be monitored. For example, for insulin, you need to do your blood sugars. For CKD medications, you need to do your HB or your calcium or vitamin D status, things like that. So these are the fundamental points that you are going to quickly tell the patient about in a short span of time. The stage two comes where the medication information exchange is offered. So this in which you encourage questions, then you give some detailed information on those questions, and you satisfy the questions patient is asking, so that there is no ambiguity left in the patient's mind, and patient is feeling safe to take that medication and feeling confident that he understands what to take and how to take. And stage three comes where the medication education, comprehensive kind of a teaching session is there, where comprehensive information is provided, and it's kind of a learning experience for the patient and their families, that how they're going to use this medication. And usually they are done for those medications which have a very high cost, which have a very high side effect profile, or they have a very low margin of safety, narrow therapeutic index drugs. So those medications really need a comprehensive medication information. And stage four is the medication counseling session, where based upon the previous stages, and now the patient have started using the medications, and now patient is experiencing some problems and issues, and now you are trying to mitigate those problems with specific examples that correlates with the patient's life. For example, patient tell you, okay, I tend to forget taking this medication. So you can ask patient, okay, what is the thing that you do on a regular basis? Suppose the patient tells you that I always go for a morning walk, and this is my schedule and I don't miss it. So you can tell that, okay, just link that taking of medication with your morning walk. Either you take it before or you take it after, depending upon the type of the drug. So you make sure that this is how patient tends to remember that this medication is to be taken. Or you can maintain a diary, or you can put an alarm in the mobile phone at the designated time, and things like that. So you can have personalized solutions for whatever patient is telling you that I'm having difficulty with this particular thing. So at stage four, you inform the patient about those remedial steps. Now, quickly about the communication essentials. What are the important information you must possess? Skills you must possess. So obviously, the first thing is the verbal skill, how you're going to use the language. Unfortunately, what I've seen in my practice that both pharmacists, nurses, and doctors, they tend to use medical language, the jargons. But patients don't understand them. So if you tell patients this medication is for your hypertension, obviously the patient is not going to understand what is this hypertension means. So you are going to tell the patient in a layman terms that आपके blood pressure के लिए दवा है, आपके जो है उसके लिए हम इसको कंट्रोल में रखने के लिए दे रहे हैं, आपको 140/90 या 130/90 या जो भी आपका टारगेट डॉक्टर ने सेट किया है, इसके मुताबिक हमें ये दवा आपकी एडजस्ट करनी है. तो सिंपल लेमैन लैंग्वेज में आपने पेशेंट को एक्सप्लेन करना है, नो मेडिकल jargons. Tone, volume, and speed is really important, क्योंकि many of times we are in hurry. Many of times we sometimes pharmacists use a tone that is not very reassuring. और वो थोड़ा सा इस तरह से होता है कि इतना तो आपको समझ आ जाना चाहिए. ये वाली टोन जो है इज अ काइंड ऑफ एम्बैरेसिंग टोन फॉर द पेशेंट्स, एंड पेशेंट अगर ये टोन पिक करेगा तो आप उसको टेक्निकली यू आर शनिंग ऑफ दैट पेशेंट फ्रॉम आस्किंग एनी फर्दर क्वेश्चंस, और वो जो है थोड़ा सा शाय हो जाएगा और वो नहीं आपसे खुल के सवाल करेगा. सो इवन इफ इट इज अ वेरी स्टूपिड एंड सिली क्वेश्चन, जस्ट मेक श्योर कि अगर आप फार्मासिस्ट हैं और अगर आपसे भी जो है वो रॉकेट के बारे में कोई सवाल हो जाएगा, तो यू विल ऑल्सो फील लाइक सिली अबाउट आस्किंग क्वेश्चन ऑन द नासा रॉकेट, क्योंकि दैट इज नॉट योर डोमेन, दैट इज नॉट योर एरिया ऑफ इंटरेस्ट और प्रैक्टिस. Same goes with the patient. So how much literate or illiterate patient is not medical literate. So whatever question they ask, without any kind of any annotation associated with that question, you need to answer that very politely. And then maintain the non-verbal skills. Proximity should be like that. The patient's confidentiality is maintained. Patient is not uncomfortable that you are too close to them. patient is not uncomfortable that you are too far away and they can't hear you. So proper proximity should be there and proper eye contact that shows respect, that shows that you are interested in their education and you are interested in their questions. So this is really important that you reassure with your verbals and non-verbals that I'm here to help you. So if your whole body, your eyes, your tone is delivering this message that I'm interested in your health and I'm trying to help you. So that is the fundamental part of the communication skill when it comes to the patient counseling. So there are different counseling aids that you can be using. For example, there are instructions written on the pharmacy labels that are provided. You can use auxiliary labels. Here you can see a lot of those auxiliary labels that we are using in Shifa. Then you may have arranged demo devices. These insulin pens, demo devices, rotahalers, placebo capsules, nebulizer machines, BP apparatus, glucometers, nebulizer, and many others. These can be kept at one part of pharmacy. If the patient is requiring any help, you can ask them to come in, and they can be demonstrated exactly how this device works. So you should have this available in your pharmacies. Another important aspect is the patient education brochures. So that could be definitely bilingual. You should have these in both Urdu and English so that patient can understand. And if it is about any instructions, so as you can see here, there are some brochures with pictures and pictorials. So patients, if they are not even able to read Urdu or English, they can learn how to use this or how to administer this medication with the pictures. So this is how you can aid your counseling by providing these written informations or pictograms. Okay, so next is most of the pharmacists usually ask, okay, we are very much interested in giving counseling, but we also have a lack of our own knowledge. We don't know much about the medications ourselves, so how we are not very confident in giving counseling to the patients. So these are some very common and authentic quick drug information resources that are available within Pakistan. The first six, the Medscape, RX list, up till WebMed, these are available online and they are free resources. You can type in any drug. You can get to the patient's counseling tips on these medications and even on the professional advice section if you want to see any dose, contraindication, and other aspects. And you can also see the patient counseling part, which is very simple and layman language. You can first read it and then you can explain it to the patients. And the others you listed below, the BNF, the Lexicom, and others, they are the paid ones. So different hospitals have subscriptions for these, resources. They're both online. They could be in booklet form, like BNF and Lexicom are also in books form. So you can always buy them from Urdu Bazaar and other, online book purchasing apps. So these are available and these are very handy resources. And for all the medications listed in these books, there is a patient counseling section that you can refer and you can find out, okay, oh, one, two, three, these points are to be told for thyroxine, these points are to be told for, amiodarone. So this is a very quick information provided in these resources. On the right-hand side, you are seeing Drug Infosys, Sehat.com, and Pharma Guide. These are the Pakistani resources. First of all, this gives you information that what Pakistani products are available if you're trying to identify an alternates, if you're trying to identify what are the ingredients, things like that. So these are handy resources in terms of finding a product related to Pakistan. So apart from that, many hospitals like in Shifa, we are doing these dispensing checklist or therapeutic drug monitoring forms. For example, here you can see the methotrexate oral TDM checklist. So we follow this checklist in order to ensure that the key aspects of the counseling and monitoring are done and nothing is skipped for this medication. So these kind of checklist we are using for high risk medications, high cost medications, and patients and medications with the narrow therapeutic index drugs. So you can also try to develop some of these for your top 10 high alert medications. So coming to the highlight medications, just a quick reminder for you that we have our national highlight medications list and guidelines now available. DRAP has approved it. and DRAP has put both these guidelines and list on its website. And this is the list available, and you can see some common drugs that are used on outpatient basis. And these are the drugs of interest for you that should be targeted for counseling if you are working in a hospital or a community setting. So to begin with, you can identify these medications first, and then establish your proper counseling mechanism for this drug, and then later on expand to other drugs. Because high alert means that if you are not going to properly counsel the patient, it will end up in some kind of a disaster, just like we have just seen the example of warfarin resulting in bleeding. So these are the guidelines. So once you open these guidelines, for example, you go to the antithrombotic section. First of all, it tell you why these are high alert medications, what is the error or issue associated with them. Then it will tell you about all the sections of this medication, like storage, dispensing, prescribing, administration, monitoring, and finally, patient education. So for example, in patient education, it will specifically tell you that for antithrombotics and anticoagulants, what are the key areas and aspects that you are going to educate the patient on. So these are the important guides that you can begin your counseling from and then expand to other drugs. So in summary, this is very important. Counseling is really, really important, because if you want to save the cost, extra financial burden of readmissions, complications, need of further medications, and if you want to, prevent the wastage of medications due to inappropriate storage, if you want to improve the adherence and reduce the burden of disease as the patients getting better on their prescribed medications, definitely counseling plays a very, very important part. And not to forget that these are the 7 objectives that you must keep in your mind once you are dispensing medications. So if the medications requires any one or more of these points to be told, then it means it is the best candidate for the counseling. And last but not the least, you have to ensure that there are 3 major stages where the counseling plays very important role. First stage, when the patient is admitted in the hospital and is about to be discharged. So patients are very, very confused at that stage that what medications are being prescribed to them, और घर पे जाके क्या लेनी है, वो हॉस्पिटल में एडमिट होने से पहले क्या ले रहे थे. तो that is a lot of confusion going on at the time of discharge. So that is the first point where your counseling should be initiated. Number 2, when the patient is as coming as an outpatient for the new medications or for the refill of their old used medications. So that is the point where the counseling plays very important role for an ongoing safety. And third, if the patient has got readmitted because of any drug-induced issues, that is the perfect area where you need to probe in and see what really has gone wrong, why the patient required readmission, and so that you need to address that issue and prevent any further readmissions or, God forbid, fatalities because of that recurring issue. So these are the 3 stages. So last message to all of the participants here, that that is the pharmacist, are the last or probably the lasting link in the chain where the prescription runs from the doctor, comes to the pharmacy, and pharmacist being the end point where the prescriptions will be dispensed and patients will be left alone with the medication. And you can very well imagine that based upon their judgment and their intellect and their their literacy rate, you are just leaving that important medication at their disposal कि वो जैसे दिल चाहे उसको use करे. So you are the last point where this counseling should happen, and so that patients could get better with the medications prescribed to them. So be visible to the patients and be available for their help. So that is how you can claim your role as a drug expert and a healthcare professional. So thank you very much, and I will be happy to take any questions.
Thank you so much, Ms. Salwa, for your valuable insights on this session. Hope it will be helpful for the pharmacists, especially for the young pharmacists. Now, let's ask some questions. Ma'am, first question is difference between retail pharmacy and community pharmacy.
Sorry, what is the question?
Can you elaborate the difference between retail pharmacy and community pharmacy?
Basically, both are retail pharmacies, but the only difference is that the community pharmacies are set up for a specific geographical area where the population is having access to that particular pharmacies. और जो डेवलप्ड कंट्रीज होते हैं उसमें यूजली कम्युनिटी फार्मेसीज के पास उन पॉपुलेशन और उसके जो इनहेबिटेंट्स होते हैं उनका जो है मेडिकल रिकॉर्ड्स, उनके ब्रीफ प्रिस्क्रिप्शन हिस्ट्रीज उनके पास अवेलेबल होती हैं। तो जब वो कम्युनिटी फार्मेसी में रिपोर्ट करते हैं तो उन फार्मासिस्ट को एग्जैक्टली पता होता है कि इस पेशेंट की क्या जो हिस्ट्री है वो क्या है और प्रीवियसली वो किन मेडिकेशंस पे था। और रिटेल सेटअप जाहिर है जिनके पास ये इन्फॉर्मेशन अवेलेबल नहीं होती और वो सिंपली आके मेडिकेशंस उनसे परचेज कर रहे होते हैं।
जी मैम, एक और बहुत अच्छा सा क्वेश्चन था कि कैन यू शेयर सॉरी whether some insight on the management of ADRs in case of where patients are taking multiple medications simultaneously.
जी बिल्कुल, इसमें जो इम्पोर्टेंट चीज टू रिमेम्बर है ना वो है गोल्डन नंबर ऑफ 5। क्योंकि लिटरेचर ये कहता है कि जब आपका नंबर ऑफ मेडिकेशंस ऑन प्रिस्क्रिप्शन 5 से एक्सीड करती हैं तो आपके एडवर्स ड्रग इवेंट और एडीआर का जो इंसिडेंस होता है वो डबल हो जाता है। तो इसका मतलब ये होता है कि जो भी पेशेंट्स 5 या उससे ज्यादा मेडिकेशंस पे हैं दे आर वेरी इंपॉर्टेंट टारगेट फॉर मेडिकेशन रिव्यू और काउंसलिंग। मेडिकेशन रिव्यू में आपने ये देखना है कि कौन सी ऐसी मेडिकेशंस है नंबर 1 जिनको आप कंबाइन कर सकते हैं ताकि पेशेंट का पिल बर्डन कम हो। अगर वो 6 मेडिकेशंस दिन में ले रहा है तो मैं क्या कुछ कॉम्बिनेशंस ऑफर करके उसको 3 या 2 पे ला सकती हूँ, तो पेशेंट की एडहेरेंस और कंप्लाइंस बेहतर हो जाएगी और उसमें फॉरगेट करने का और ओमिट करने का डोज जो है चांस कम हो जाएगा। नंबर 2, मैं ये देखूंगी कि कोई ड्रग ऐसी जो बंद की जा सकती है या उसको जो है एक ही ड्रग उसका काम कर रही है तो दूसरी की जरूरत नहीं है, हम डुप्लीकेशंस को अवॉइड कर सकते हैं। तो मेडिकेशन रिव्यू पहली इसकी स्टेज होगी और फिर जब आप फाइनलाइज कर लेंगे लिस्ट तो फिर देन यू हैव टू प्रॉपर्ली काउंसिल द पेशेंट ऑन द ऑब्जेक्टिव्स दैट आई हैव डिफाइंड।
जी थैंक यू मैम। एक और अच्छा क्वेश्चन है मैम कि कैन अ फार्मासिस्ट रिकमेंड प्रोफिलैक्टिक ट्रीटमेंट इन द पेशेंट काउंसलिंग लाइक यानी कभी कोई ऐसी सिचुएशन हो तो हम एडवाइस कर सकते हैं फार्मासिस्ट ड्यूरिंग काउंसलिंग।
देखिए, फार्मासिस्ट की अगर आप पाकिस्तान में बात करें तो आर जुरिस्डिक्शन रिमेन्स ऑन ओटीसी मेडिकेशंस। हम अगर ओटीसी मेडिकेशंस में से कुछ ऑफर कर सकें तो यस वी कैन ऑफर दैट। लेकिन अगर आपको कोई और चीज़ उसमें आपने करनी है तो फिर उसके लिए आप ये पेशेंट को गाइड करेंगे कि आपका ये इशू इन फर्दर मेडिकेशन के लेने से या इस मेडिकेशन की डोज को चेंज करने से हल हो सकता है। प्लीज़ आप अपने डॉक्टर के साथ इसको डिस्कस करें ताकि वो आपकी प्रिस्क्रिप्शंस को अमेंड कर सके। तो उस केस में आपने प्रॉपरली गाइड करना है। और पेशेंट जब उस बात को समझ आता है तो वो फिर डेफिनेटली अपने डॉक्टर से जो है राब्ता करके अपने डोज को ऑप्टिमाइज करा लेता है या नई मेडिकेशन उसमें ऐड करवा लेता है।
मैम एक और क्वेश्चन है, कैन यू प्लीज एलैबोरेट मोर अबाउट नॉन वर्बल काउंसलिंग। जी एक और क्वेश्चन है मैम।
जी जी, नॉन वर्बल काउंसलिंग,
हाँ
देखिए
कैन यू प्लीज।
काउंसलिंग नॉन
हाँ।
वर्बल नहीं होती है। काउंसलिंग नॉन वर्बल नहीं होती है। काउंसलिंग जो होती है उसकी कम्युनिकेशन स्ट्रेटजी में जो है आपकी नॉन वर्बल स्किल्स इंपॉर्टेंट होती हैं। दूसरा ये है कि नॉन वर्बल में आपने अगर कोई ऐसा टूल या एड यूज करना है कि जैसे आपने कहा कि आपकी ये इंफॉर्मेशन के लिए मैं आपको एक वीडियो लिंक भेज रही हूँ, आपने इसकी डिवाइस के लिए ये वीडियो को अच्छी तरह
राइट
से
सर,
देख
बिल्कुल
लें।
ठीक है।
तो
तो
उसमें भी
वो
आपने
पूछना ये चाह रहे हैं
वर्बली तो आपने
कि
इन्फॉर्म करना है।
जी मेरे ख्याल में सारे क्वेश्चन बड़े वेल आंसर्ड हैं इस वक्त मैम।
ठीक है जी, थैंक यू वेरी मच। आई थिंक moderator can then wrap up the session if there are no more questions.
Thank you so much, ma'am. I'm grateful to all the participants for joining this session. We appreciate your time and commitment. And feedback form will be shared to you shortly after this session. And we will meet next month with another exciting session. Thank you so much. Allah Hafiz.
जस्ट एक इसमें मैं ऐड कर दूं, थैंक यू एवरीवन। लेकिन जो इसकी रिकॉर्डिंग है वो फार्मेसी की वेबसाइट के ऊपर जो यूट्यूब की स्पेस की वेबसाइट है उस पर रिकॉर्डिंग हमारे तमाम सेशंस की अवेलेबल हो जाती है। सो इफ यू वांट दैट यू कैन चेक इट आफ्टर 2-3 days। स्पेस फार्मेसी यूट्यूब की जो वेबसाइट है वहां से आप देख सकते हैं।